Hey y'all, so for Journal Club Form 5, I was assigned the topic Assessment and Interventions for Tendinopathy of the Elbow, Hand, and Wrist. And so before we talk about the article, I wanted to really talk about what lateral elbow tendinopathy is, as this is what the article really focuses on. And so the textbook defines tendinopathy as any pathological change to a tendon. And so lateral elbow tendinopathy, based off of the tendinopathy definition, you can guess it's in the lateral elbow. And it's a condition characterized by failed tendon health response. And it's actually kind of a common condition that arises from the extensor forearm muscles. And this is about 3% of the cases annually that therapists will see. And the most commonly affected muscle is the extensor carpi radialis brevis. And it can be caused by repeated loading of common extensor muscles beyond the physiological limit, which can result in microdamage to a tendon. And an example of this would be repetitive twisting motion of the forearm with forceful grasping. So that's just one example of how this can occur. And then so just some basic information about the article itself. I did upload the PDF so you can see it there. But the title is called The Effectiveness of Eccentric Strengthening in the Treatment of Lateral Elbow Tendinopathy, and it's a systematic review with meta-analysis. And these are the two authors that did this study, and it was published in the Journal of Hand Therapy on April 11th, 2020. So just a brief overview, the goal was to investigate the effectiveness of eccentric strengthening compared with other forms of strengthening and pain relieving modalities on pain, strength, and function in people with lateral elbow retinopathy. And the reason why they wanted to do this was because traditionally, lateral elbow tendinopathy was believed to be due to acute inflammatory process of the extensor carpi radialis brevis tendon. And so therapy reasonably focused on reducing inflammation, because if you want to fix something, you got to know why it's caused and what it does, whatnot. And so if you think you have inflammation, you're going to work in therapy on reducing that inflammation. But currently, there has been evidence to show that this actually occurs due to degeneration of your connective tissues and not inflammation. And we'll talk more about why that's really important later on. So the research design, it is a meta-analysis, specifically a systematic review with the meta-analysis. And they obtained articles from 5 electronic databases. And the meta-analysis were performed using a random effects model with standardized mean differences, test of heterogeneity, and sensitivity analysis. I'm pretty sure I said that wrong. Heterogeneity. I'm really bad at pronunciation, so we're going to move on. The methodology, so the procedures, they searched 5 databases, like I said, and these databases include Embase, PubMed, Google Scholar, CINAHL, and Cochrane Central Register of Controlled Trials. And they used some of the search words that included elbow, tendinopathy, tendinitis, eccentric strengthening exercises, eccentric resistance training, words along those lines. And then for inclusion criteria, these articles that they found had to have the following: experimental trials on individuals with a diagnosis of lateral epicondylitis, and they had to compare different interventions with at least one group receiving eccentric strengthening. And what I mean by one group is controlled and your treatment group. One of them had to receive eccentric strengthening, and then included outcome measures of pain, strength, and function. And then the exclusion criteria, thesis dissertations were not used, if they did not contain outcomes of interest, and then if they presented insufficient outcome details for data pooling, and if they didn't have any active comparative groups for eccentric strengthening. So if there wasn't like a control versus treatment, and there was only just treatment, they wouldn't take it. And then for measures, this journal article itself uses 11-item Pedro scale and standardized extraction form. And then the articles that were evaluated in this study used multiple, and in the next slide I'll show you what they used, but all of them used the VAS pain scale. And so this is the chart that I was talking about with the methodology. And so in the first column, these are just characteristics of the study. So in the first column, you can see what studies there were. They ended up using 8 studies. And let's see, 1, 2, 3, 4, 5, 6, 7, 8. Yeah, there's 8, and they're listed below. And then you can see what their study design was. And at the bottom of the chart, it tells you what all those abbreviations are. I feel like we all know RCT's randomized controlled trial. And then you can see like the patients, the number of patients, how many were in the treatment groups, how many were in control groups, how long it was, the duration of the treatment, and the mean age. And then the next column, you can kind of see where the interventions, it gives you what treatments they were given. So some groups were just given eccentric exercises. Some had the eccentric exercises with modalities. And you can also see what was in the control group, what they were going through. And then you can see the outcome measures. And these are how they measured treatment versus control. So all did the VAS pain scale. You can see there's DASH, pain for grip strength in some of them. And then in the last column is how they measured, how they being the article that we are reading, how they did that. For results, so the number of participants that they had total, and when I say number of participants, because this isn't a trial, it's a systematic meta-analysis review, what they mean is that out of all of the studies that they looked at, there was 504 patients in those articles total. There was 218 in the experimental group and 286 in a control group. And then the age ranges in 8 of these articles were between, these are mean ages, so about 35 to 50 years. And then all of the participants had symptoms lasting more than 3 weeks. And treatment, what they found across the board, eccentric strengthening, and this typically came in 3 sets of 10 to 15 repetitions. And I believe it said they had a 30-second to 1-minute rest break in between. And then programs lasted, there was a range, but typically from 3 to 12, 3 weeks or 12 weeks, but somewhere within that range. And then all of these articles consisted of supervised clinical exercises and or home exercises. So they either had both or one or the other. And then the results found that it supports the effectiveness of eccentric strengthening in the treatment of pain, strength, and function for patients with lateral elbow tendinopathy. And then they also found from these results that in short-term treatment, eccentric strengthening is superior to other treatments in regards to reducing pains and functional movements. And then relevance. So like we said earlier, this is a common condition seen by occupational therapists, and this article said about 3% of the population annually. And understandably, it affects occupational performance and their ability to complete occupations, as well as their quality of life. I feel like we all can put that together. If your occupational performance is affected, certainly your quality of life can be too. And this can be caused because of pain. Many patients reported in this article that they had pain at the lateral epicondyle during activities. that would require contraction of those extensor muscles. And then pain would also occur distally down the forearm, which can have an effect and result in poor grip strength and functional use of the hand. So a lot of those fine motor skills were kind of difficult for them to do, understandably. And then my last 2 points for relevance, I know I talked about, like on the second slide, I believe, about what traditional treatment was versus what it is now, and evidence supporting eccentric strengthening. And what I wanted to say about this is it's really important because we want to do the best, most current practice for our patients. And for lateral elbow tendinopathy, this used to be focusing on reducing inflammation. And interventions during therapy sessions was focused on modalities such as the ones I have listed. So ultrasound, low level light therapy, ice, and others. And evidence has shown that these modalities have mixed results. And then as you saw in the studies, the 8 studies from that chart, some of them mix these modalities with eccentric stretching or strengthening. So I found that really interesting. But it's really relevant because that is what we did in the past. But currently, we really need to focus on best practice. And this article really shows that eccentric strengthening is the best practice to treat the tendinopathy. And so my article appraisal, strengths. I said increases generalizability, pooled estimate of effect, and I had to look that up. And a pooled estimate of effect, it gives you the weighted average of the intervention's effects in individual studies, if that makes sense. And then it tests, and here we go with this word, heterogeneity. We'll have to double check how that's pronounced. Anyway, and then inclusion and exclusion criteria, they were very specific with what articles they were using. So I think that was a strength. And then weaknesses, I said risk of biases. The article itself actually limits these two as weaknesses, and I definitely agree with them. I think the article said there was a risk due to publication bias and due to the varying eccentric strengthening regimens. And what they mean by that is like the mixing of eccentric strengthening with modalities and stuff like that. And I definitely agree with that. I think that is a risk of bias, but I believe that there may be a little bit of researcher bias, just because they were looking, I think they were looking to confirm the thought of eccentric strengthening as an intervention. So I think that there could be some bias there, which is why these articles, a lot of them said that it does, that there is improvement. And then the number of article used, I said, was a weakness, while there were a large number of participants, like 504 in the 500 range. That is a lot of participants. But I think that the number of articles, since it was only 8, I think that's a weakness, and that they could have used maybe some more articles to establish that. And then these are my references.